Hey, welcome, Dr. Millie.
Yay. Hi, Preeti. Namaste.
Namaste. So, I am very happy to have Dr. Millie here. As always, I'm very excited. She's going to teach me something today, which will help me help my patients better. But before I start with today's topic, which is ozone therapy and psoriasis, right? I want to share with everybody here that Ozone Forum of India, under leadership of Dr. Millie Shah, has done 130 doctor training programs till now and has trained 3,600 doctors in ozone therapy. I think we need to give a loud applause with the clap to Dr. Millie for this, because this is not easy, Millie, I know. And you've been doing this very consistently and very nicely.
Thank you. Thank you, Preeti. That means a lot when it comes from you. And as you say, you are going to learn from me. I always learn from you how to be happy, how to be always smiling, how to be, the most confident person I have ever met. So thank you, Preeti, for inviting me for this lovely talk show, which I think I'm coming on this second time or no, third time, maybe. And very happy that you are also consistently spreading awareness about functional medicine, different streams of alternative medicine, and I'm really happy to be on this show. Thank you. Thank you.
Thank you, Dr. Millie. Perfect. So, Millie, this time you had spoken in IFM conference on ozone therapy and psoriasis, right?
Yes.
Psoriasis has always been a very close to my heart subject, and I'll tell you why. This was about 6, 7 years back when I had a patient who came by bus. It took him 5 hours to reach my clinic, and he was full of patches everywhere, and people in his family and around were saying that you have some chuachut ki bimari. Okay,
Acha.
it was that bad, and when I saw it, it was psoriasis. Okay, and the moment I knew it was psoriasis, I knew that we can make a difference in this person's life. He was 31 years old,
Oh my God.
so very
That's
young. Yes, पूरी लाइफ सामने पड़ी थी, एंड वो बच्चा या लड़का जगह जगह ढूंढ रहा था कि मैं कहाँ पहुंचूं. ऑफ कोर्स नॉट फ्रॉम अ वेरी गुड फैमिली कि भाई वो इम्यूनोसप्रेसेंस पे आ जाए या कुछ, एंड कुछ भी और वाज नॉट वर्किंग फॉर हिम. From there, I realized that. So after that, a lot of psoriasis patients have come to me, and very surprisingly, these patients whom I'm talking about, they come with a history of 18 years old psoriasis diagnosis, 25-year-old diagnosis. None of them come like मुझे कल psoriasis हुआ है जी और आज मैं पहुंच गया हूं आपके पास. That at least I am not seeing in my practice. ठीक है?
no, no.
But when we start working with them, with Coimbra's protocol, with ozone therapy, with functional medicine tools, and with diet and
Yes.
stress management,
Yes.
I see miracles happening. And when I see these miracles happening, there's a lot of confidence which comes in you. And you know how that I can prove that my confidence has really risen when it comes to treating psoriasis is, I did a
Yeah.
YouTube live with my sister, who is a dermatologist.
Okay. A twin
Okay,
sister.
not twin sister, with my younger sister, who is a
Yeah, but she
dermatologist.
looks like you.
Yes.
Okay.
And you know what? She started talking about psoriasis, and I said, psoriasis is not a skin disease. And she was like, huh? And I said, it is a systemic disease.
Yes.
Right? Yes. And so
Yes.
on this, Millie, over to you. Please share with us, how has your journey with psoriasis patients been going? How did you start getting involved with these patients? And what happened during your journey, which actually made you focus on these patients, that you are writing a full paper on
Yes.
psoriasis and ozone therapy?
Yes.
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 Yes. Over to you.
Um, So I'm very happy that you could help a psoriatic patient, because psoriasis um, is a systemic disease, which means that it once it comes, it is not going to be leaving your body so easily. So that's how people come with a history of 18-year, 25-year-old. I have a patient who has psoriasis for 35 years. Okay. And the patient right now is 55 years. So he got the first bout of his psoriatic attack when he was tremendously stressed when he was appearing for his, UPSC exams. Okay. This is at that time he was a student. Today he's like a good big personality. But uh, and they remember clearly that what triggered it. So there are main three reasons for the psoriasis to trigger in somebody. One is a gut issue. The gut is completely leaky gut. This gut dysbiosis. The whole gut is fully, there's no nutrition getting absorbed. So the diet, the gut, and the emotional stress. These three prongs together are the main reason for your autoimmune condition of skin and inflammation. And whenever any of the prong gets disturbed, it would come up. So people keep treating it for years and years and years. It keeps going on with only one reason, that all three together are never tackled by anybody, mainly dermatologists. What they do is they look at the outer part of it and they try to cover it up, like put creams, take few antibiotics, take some steroids, put it down, suppress it. But the main cause is not treated, Preeti. And of course, you know very well this. The main causes for any psoriasis, is mainly your gut detox, So if you go and take a history of any psoriatic patient, they will either have constipation, they will have tendency to eat more sugar. Okay, so their dependence or the environment inside the gut is always acidic, and lactosis is there. Okay, along with that they have tremendous stress. So I have seen, mainly all psoriatic patients have financial stress. Okay,
Yes.
and it is a known thing in Ayurveda that the stress of existence leads to psoriasis. Okay, so mental stress, dealing with mental stress is very, very important in any psoriatic patient. And the third important is nutritional deficiency. Okay, I think the skin requires the most nutrition, because it requires all the minerals, all the vitamins to balance its existence, because the skin is the largest organ of your body. And psoriasis happens to skin, slowly moves on to joint, slowly moves on to the heart muscle. So all muscle and skin, so everything which is in a smooth areas, it obviously spreads faster. So I would say, if you want to treat psoriasis, and you are right to agree to argue with your sister that it is not a skin disease and it is a systemic disease, because if you want a resolving of patient, you need to work on all three. So you have to have a protocol which is dealing with all three. Okay,
Yes.
and I have worked with many psoriasis patients, of course, but few which I have been now going to be, documenting the case series. I'm documenting and also working on, getting a research paper done with giving, you know, uh, giving the understanding of the whole, perspective towards how this integrated approach can help psoriasis. And it has like मुट्ठी वाला प्रोटोकॉल, एक अकेला ओजोन से नहीं होगा, एक अकेला फंक्शनल न्यूट्रिशन से नहीं होगा. इट हैज टू बी आयुर्वेदा, होम्योपैथी, ओजोन, न्यूट्रिशन टुगेदर. द अप्रोच हैज टू बी
Because
all
it's a
round
systemic,
to improve an autoimmune condition.
because it's a systemic condition. So before I come to your interesting cases which you have done, I want to tell the audience. Basically, psoriasis, what happens? The maturation time reduces and there is increased turnover rate. And that's the reason we get those psoriatic patches, right? These patients, like you said, gut health, there are certain infections which are very, very commonly seen in psoriasis patients. Most commonly seen is fungal,
Yes.
candida overgrowth, right? That's the reason you will see that they will have a lot of dandruff, they will have a lot of itchiness coming from fungal. Second, parasites may blastocystosis and entamoeba are very commonly seen in psoriasis. Streptococcus is another thing where we have excess of this, which leads to gut dysbiosis, right? So these are some of the bare minimum infections which have been correlated with psoriasis, and all this has been published in conventional medicine journals, high impact factor
Yeah.
conventional medicine journals. Why I'm saying this is that, guys, whatever we are sharing with you today, it is not some thing which somebody said somewhere. We are talking about published data in good impact factor journals, right? So this is pure science, and this is just extension of conventional medicine. It is not
Yes.
alternate, right?
Yes.
So, and I thought I will add this so that you understand. Second thing, which Dr. Millie has very rightly said, but I will want to say it a little differently, is nutrition. These patients are generally deficient in a lot of nutritional minerals and elements, but we have to go one step back. All these patients are making less acid in their stomach. All these patients. And the moment you give them acid from outside, betaine HCl, the first thing you see in 2 3 days is their itching starts to reduce.
True.
Because undigested, less acid means undigested food and nutritional deficiency. You increase acid, your nutritional deficiency improves. Your protein, zinc, magnesium, B complex improves, right? And infections decrease, so itchiness comes down. And therefore, this cannot, be corrected just by applying a cream on the skin. You have to do
Agreed.
multiple things, like Dr. Millie said. And on this, Dr. Millie, can I request you to share some of the cases of psoriasis which who came to you, who were in bad
Yeah.
state, and but when you did your holistic approach,
Yeah.
their results were not less than miraculous.
Yes. I would love to do that. So, say, many patients I've treated, but few, three, four, I will enumerate because they all come from different background and different, the different reasons for getting psoriasis. Let's say that way. Okay, so the one person, the 54-year-old male came to us with a sudden. I mean, of course, he had a history of psoriasis when he was 20 25, but it was under control. I mean, actually, he forgot about that he had a bout of psoriasis in his early days, because at that time it was just treated quickly, and he recovered faster. But this, at the age of 54, when it came, the full legs and the trunk was completely, the gutted eruptions, the eruptions which has prurite, like severe itching, continuous itching, that the sleep is disturbed. The patient would just sit and, sleep, so that whenever it itches so much that he can rub it, like, so the condition of his was, he was sleepless nights, severe pruritus, lot of burning So, how it burns under the, as if a coal is there on the body. Okay. And he presented with this and came to us because he already knew ozone, and he was taking ozone for some pain management and so on. Okay, so he just came and said, okay, this, I've been getting this for last 10 days, and I had a history, but the you know and I mean, in those days, when you're younger, you get recovered very fast. But now, as the age, and of course, the gut dysbiosis and everything is far deeper than what he had in his early days. So we saw that he had severe bloating after food. So as you said, less acid was there, the digestion was not there, itching, burning, sleepless nights, and eruptions. Okay, so what our ozone therapy we do is, the first and most we do is something called rectal insufflation. It is an ozone enema. So what do? We improve the detox of your gut. At the same time, we improve your liver. So liver is your governing organ for your digestion. So we are detoxifying the liver. We are working on. So we decided that yes, rectal is the right thing to give this person. At the same time, we have a beautiful application with ozone. It's called minor autohemotherapy, where I am taking 2 ml of your blood and in an ozone syringe, and I'm re-injecting that blood in the patient's hip region. Okay, what do I do? What am I doing with this? It's called auto vaccination. So the minor auto is called auto vaccination. So I'm taking your blood and giving it back to you, where I will develop a cell specific antibodies. So you are not dependent on something from outside to take, as an immunosuppressant.
Hmm.
Or okay, so you are making your cell specific antibodies which will reduce your nuclear factors, erythroid kappa b. So basically it will reduce your inflammation. So these two were, of course, was the first choice. But then patient was like, I can't come every day, I can't do this, I can't do that. So we just said, okay, you can't come every day, we will plan 2 times a week or 3 times a week protocol, but that you need to adhere, otherwise you can enjoy with your burning and itching, so that sometimes I am very blunt with my patients. If they say, oh, I just can't make it, only how can I treat you then? Okay, so the patient, we decided that we will call him 2 times or 3 times according to the convenience, but 2 times minimum. Okay, that is like mandatory. Okay, we started, yeah. We started one time rectal minor, and the other time we give major auto and minor auto together. So where what I'm doing is working on the gut, improving the autoantibodies, and improving the circulation. So ozone at the best I have given, and we gave skin blossom cream
Yeah.
for application on the surface. And there is also one more oil we call it. It's called 777 oil, which is also very good for moisturizing. So skin
Yes.
blossom is good for detoxifying or reducing the fungal load of your, but you also need moisturizing. So that 777 oil is a very good moisturizing oil for the psoriasis patient. So started with that also. Along with that, I started working, in homeopathy we have something to calm this patient. You have to calm the mind, otherwise the stress level will be very, very, very difficult to deal with. Okay, so we started him with a medicine. It's a very simple. It's called rescue remedy. Okay, it's like a backflower medicine. So it's a just drops. You take 4 5 drops in the mouth, and we started rescue remedy and homeopathic medicine like Colifos, something which calms your nerves and calms your mind, and you sleep better with it. Okay, so this was also added. Coming to after rectal, the flushing of the gut was is also equally important. Okay, I could have taken support from senna tea or some herbal tea, but in Ayurveda, one of our very dear friend, Dr. Rajeshwari Booch, she's a very good Ayurvedic doctor. So she said, Abhipatti Kari Churna. It's a churna which induces it flushes your gut faster, and you are, passing a good amount of stool. In that bargain, you are also detoxifying your liver and gut. So this is how, like with ozone, with a small medicine from Ayurveda, little medicine from homeopathy, we started with this. Then after 1 month, we required a healing to be faster. Okay, so then I added IV nutrition. Okay, because the patient was put on the vitamin D3. Coimbatore protocol helps very well. And but patients are not ready. At least this patient was not ready to take zinc every day orally. He was not ready to take magnesium every day orally. I felt that he would require a trace mineral because he needs chromium, selenium, and other manganese also for improving the skin. So we started giving him advanced immune drip, we call it. So it has N-acetyl cysteine L-carnitine as an amino acid to a building block for your skin. We also started him with a detox of vitamin C, magnesium, multivitamin, and in the end we gave him trace mineral. So the protocol was devised in such a way that ozone was given 10 sessions, 3 sessions of nutrition were given, and of course, this Ayurveda and homeopathy gave him at home a good combination, and this patient improved within 1.5 month, completely cleared up. I think that pictures I had put on the in IFM lecture.
Yes.
Okay, so that was there. So this was the old inflammation recurring. Okay. Now I want to tell you another patient who is just 29-year-old. Okay.
Wait.
IT professional.
Dr. Millie, before we move to the next case, you said something like major auto and minor auto at the same time and the same day.
Yes. Yes.
Yes. So could you elaborate the mechanism of action and which patients are the right fit for major and minor on the same day?
Only autoimmune patients can take. No other place we give minor and major together. Only in autoimmune conditions, say RA, psoriasis, multiple sclerosis, and fibromyalgia. These are the only cases where I give minor and major together.
And
So we
chronic
need an assistant.
and chronic fatigue syndrome?
Chronic fatigue syndrome will get better only with rectal and minor also. Okay, they can be done only with major auto also. Chronic fatigue syndrome doesn't require, mainly where I want autoimmune correction, where I want antibodies to speak, to start doing dialogue, and cell specific antibodies, autologous antibodies to start doing the dialogue. That's where I give this minor and major together.
And which one do you do first and which one do you do second?
So we do my so for major auto we take a scalp vein, we take the blood. On the
Yes.
third way, I keep an empty syringe with ozone,
It
and
for
I
minor
take
auto.
blood, and then my one person, the one doctor is doing the major auto only, but I just take 2 ml of the blood, and I just
And
tell patient to turn it and give it.
okay. Yeah, yeah, yeah. So at the
Okay,
same
that
time, I wanted people to get clarity that you can do it
yes,
at the same time because the route and the mode is different.
yes, yes, yes. Okay. So it's extremely beneficial in these patients to do this work, extremely and very easy. If you have an assistant to help you with this, It can be done. And you know, Dr. Jignasha is extremely well versed with these applications. So, you know, she does it
It is
very
easy
nice.
to do. I just wanted it. People should understand it. Otherwise,
Yes.
maybe, yeah, because basically when the major auto starts, you're not doing anything else.
Yes. No, the
Because
doctor has to be
right.
focusing only on the patient when you are doing major auto. There is nothing else you can do.
वन इंजेक्शन एक बम पे इंजेक्शन ही तो लगाना
हाँ.
है ना
और ओनली
राइट
थिंग कि patient को हाथ बोलना है, हाथ नहीं हिलाओ.
यस या परफेक्ट सो देयर इज Dr. Achonitz is saying in scleroderma morphia also you can do major auto and minor auto together.
Yes, you can.
Okay.
For scleroderma, ozone works extremely well with rectal minor auto. Do 10 sessions of rectal and minor auto, and then you can move on to, the major
Major
auto and minor auto together. Okay.
perfect.
But
29-year-old
see,
case.
now again, this patient, again, full body bagging works extremely well for ozone.
I love it for psoriasis patients. And
Yes,
patients
yes,
also love it.
yes,
After one, therapy session, they come back and say, this really helped. Hair bagging helped, leg bagging helped, pura ozone sauna helped. So,
yes.
yes, they fall in love with ozone.
Yeah. Yeah, because it shows immediately the benefit, right? It You feel like, and see, the day itching stops for them, that is the battle is won.
Yeah, it's a big
Because
yes.
yeah, because itching is so troublesome, so
Yeah, their
troublesome.
quality of life goes for a toss. They can't go out anywhere. They can't mix with people. They can't sleep. They can't do any work. कोई focus नहीं हो पा रहा होता. So of course that's a big, big, big problem, right?
Yeah,
So Dr. Mili, this 29-year-old case.
yeah. So basically he had ongoing psoriasis for 5 years. Okay, and it had begun with the stress of COVID lockdown. Okay, sudden lockdown, this thing, sudden job loss. He was really, from he didn't know what to do. Too much of pressure from the family. At that time he was just 24. So they feel as if their life has gone for a toss. And this patient, of course, came to me through and through, via. And when he came, the full hands, full legs, trunk, everywhere. Besides his face, everything had psoriasis. So he would, wear those full sleeves t-shirts, track pants, you know. Uh, I mean, when he entered, it was, I think, in May. And full sleeves or full track pant पहन के बच्चा कोई आया है. I'm looking at him. I'm like, oh God. And
Right.
um, their condition is he's continuously doing this. You know, so when you are doing case taking, that time also you wonder ki, what is happening to this person, right? So he was on antipsychotic medicines because the doctor said that your skin is fine, but it is something in your mind that you are feeling this. Okay. He was on antipsychotic medicine. He had taken like 3-4 rounds of steroids for 1 to 2 months to reduce this. It was completely full blown case of psoriasis with, and he would not be meeting his friends, family, because he's like, I can't go like this to them. It is not really right. He would not, he had taken work from home, that I don't want to meet my office people. They'll say, "Why are you wearing this full things, and coming?" So
Right.
he had lot of inhibitions. Uh, he came. We started, of course, our main thing, of course, Coimbra protocol, and he was ready to take oral nutrition. So and of course not so well to do कि IV nutrition पे करेगा. He was happier doing the oral nutrition, and I wanted him because it's like 5 years. I can't reverse it so fast. Okay.
Right, right. You have to plan it and go slow.
Yeah, yeah. And the body is under oxidative stress also, right? So I can't push his body beyond a certain. So we began with rectal minor and full body bagging. Okay. And also again time problems, time constraint. So I had given him ultimatum. You come 2 times a week, otherwise don't come for treatment. Done. Okay. So
After today's YouTube live, Dr. Millie, people will know you as Ultimatum Doctor.
they can tell me that. See, if you want something natural to work on you,
Yeah,
you can't
otherwise,
expect.
डॉक्टर मिली कुछ करने के लिए कुछ पाने के लिए कुछ खोना पड़ता है. So if
सही
you
बात है,
want to heal
थोड़ा
yourself,
टाइम तो
you
देना
have to
पड़ता
lose some time. Yes, बिल्कुल.
है. थोड़ा
So
टाइम.
you have to
So
feel bad about
maybe your audience is going to say कि ये बड़ा disciplined doctor है, ऐसे नहीं चलाती है. But what to do? Because I am giving you pure oxygen, converted some part of it into ozone, wanting that ozone to work in your body to improve major biochemical pathways. So it has to be uh, given, at the consistent level. It cannot be like I will give when I want to take. It cannot be like that. You have to give it repeatedly to improve, patient, right? So I feel, so he started with, of course, high dose vitamin D3 also. We gave him, here I used, gut detox, like first we started with ivermectin. We gave, then Normet, then we gave, Flucon. So basically, all in detox,
it.
gut detox
Parasitic and
had to be given
antifungal.
because, yeah, because his body was completely, I felt that too many things happening at one moment. So I had to put him on antimicrobial detox basically. So everything one by one we addressed that. Ozone of course improved the gut dysbiosis, and rectal was given, and the of course the oils and creams, ozone oil, cream, everything was given. So this particular boy, I think he took 4 to 5 months to get better, but he got complete resolving for at least 1.5 year.
Wow,
Okay.
very good.
So the
Huge.
first patient who I said, 54-year-old, is still date fine. Some up and down little bit comes, but not on medication, not on treatment also, um, not on ozone or nutrition, yes. But that is a part of, like, magnesium is given to sleep also. So it's
Yeah.
like it's a normal
Like
functional
eating food
medicine
every
prescription which
day.
we do.
No, no, it's like eating food every day. You need food every day. Today I had a
Yeah.
patient, I said, let's do some fasting. She said, no, 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 no. My moods go for a toss when I do fasting. You have to make me eat food. You decide how my body thinks that it is fasting.
The
ठीक है
ball is
ना?
in your court, huh?
Ball is in my court always. ठीक है? When you have smart patients, better keep the ball. They make sure that the ball is in your court. है ना? So supplements are like that.
No.
See, some of the supplements you have to keep taking off and on because nutrition from food is becoming very, very difficult right now.
See, the soil is depleted. Soil is depleted. We use so much. Not everybody can afford organic, and we don't get good organic food in India. Okay, it's not very easy. Like, at least in Mumbai, I'll have to search and hunt.
No, no,
There
but
are webs.
we have very good sources in Gurgaon. Every Sunday we have 2 3 organic markets. where the farmers
Yes.
come themselves and tell you how things are, and their delivery
Agreed.
also they do at home. I am extremely happy with them.
Agreed. In Mumbai also we have farmers market. But if I am living in South Bombay and if it is happening in a suburb, going there is 2 hours.
5 minutes dura. It's my favorite Sunday pastime.
That's
Honestly,
good.
it is a feast for your eyes. The color of the vegetables and the type of knowledge these people have who come along with. They are there for 4 5 hours. I go in the morning and I don't want to come till all of them have packed up.
Until
Because
you have packed up your bags.
no, till everybody else has packed up, because everybody has so much knowledge and so much passion. Organic farming doesn't happen easily, no. It involves a lot of work. Like functional medicine, you have to do so many things. No?
Yeah.
So, but
Yeah.
I definitely feel everybody should visit organic markets at some point of time, and
Yes.
you will think of it as a when you were a child, you used to go to amusement park. Now at my age, it's the organic farmers market where I go and enjoy the same, amount as much I used to when I used to go to that amusement park. So imagine.
Amazing. Amazing. You're motivating me to go to this Bandra market.
Good. That was my whole intent. So if that's been achieved, I'm happy.
Okay. So this patient, we started him, we have then moved on to Major Auto also, but his full body bagging continued and Major Auto oral nutrition. He's doing far better. He's doing much better. It's not that he's, but what happens now when he's coming after 1.5 year, now his patients are so the first time his Josh was there, he was very enthusiastic and everything. But when they have to do the whole thing again, of course, the this thing was not the intensity was not that much. But patients tend to feel ki why it is happening again and again. So my one request to any patient who has psoriasis, don't go into the loop of why it is happening. Okay, go into the loop of how I can resolve it. Okay, so do self analysis. Do if you have the same pattern of thinking, anger, stress, suppression, the same faulty ways of sleeping, you can't say that why it is happening again and because you are feeding your body the same thing again and again. It's not. Change it, work on it,
Yeah.
improve it.
Yeah. Thank you for adding that. But on this, I want to add one more thing with your permission.
Tell me, please.
Okay. Is I feel for patients of psoriasis or such conditions, jahan pe ki, stress plays a huge role. People keep trying to do breathing, but they are not doing it correctly. So, unless you have a trainer or a doctor who is teaching you and checking your breathing pattern, don't focus too much on breathing, guys. Better is focus on laughter. Because when you will laugh, your breathing automatically will be correct because it will be in the parasympathetic mode,
Yes.
right? But otherwise, if you will try to do deep breathing, box breathing, 4-7 breathing, 4-4 breathing, 99% of the time, these patients do not breathe correctly. They are breathing in the sympathetic mode. Second, even when you train them, they are not able to breathe correctly. So, now what I do for these patients, Dr. Millie? I call them
What
for
do you do?
ECP sessions, about 7 to 10 sessions.
Oh,
ECP.
you teach.
To teach, to shift them from sympathetic to parasympathetic. Because no amount of teaching how to breathe, they do right breathing. But
Hmm.
ECP, ECP, people think it's for heart health. Okay? People think it's natural bypass, FDA approved, right? But it has such beautiful other functions also. And the especially for women,
Mm-hmm.
it is working miraculously for me. Wherever I see there is autoimmunity, wherever I see whatever I am doing, it's not making that much of a difference. मेरा ब्रीदिंग ठीक हो ही नहीं रहा है. इवन व्हेन दे आर लाफिंग वो लंबा हंसी नहीं पाती हैं खुद से. 10
कितना
सेशन.
इनहिबिशंस है.
नहीं, इनहिबिशंस नहीं, उनका क्या हो गया है ओवर द पीरियड. इट्स नॉट इनहिबिशन. Dr. Millie, very surprisingly, what I'm seeing these days, I'll share that, but before that, let me complete this. It is they have forgotten to stay without stress. उनका बॉडी और माइंड का वायरिंग ऐसा हो गया है कि देयर इज ऑलवेज अ टाइगर और अ लायन रनिंग बिहाइंड देम. एंड सी, दिस इज अ टाइगर और अ लायन बिहाइंड अस,
Yes,
right?
yes, agreed.
Yes. All the Wi-Fi, all the toxins, all the bad AQI, all of this is keeping us in that flight and fight mode. So breathing पे please take your time, have a sequence. Laughter, laughter, laughter. Because laughter में एक level of intensity जब पहुंचती है ना, that is where your mind gives away and you shift to parasympathetic. फोर्स आफ्टर में नहीं होगा कुछ भी.
No. Not he, ha 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 se hoga.
Because that's when you shift to parasympathetic. Now, another thing which these people should do rather than breathing is humming.
Yeah. Brahmari is also very good.
Very, very effective. Humming, even better than Brahmari. Because Brahmari में भी ना जब आप ये करते हो ना, तो थोड़ा सा वो स्ट्रेस वाला मोड एक्टिवेट हो जाता है. ठीक है. हमिंग. एंड अगर हमिंग भी नहीं हो रही है,
Singing.
हाँ,
Singing. गुनगुनाओ.
Better than singing. Yes, better than singing. Something which we do but we don't do correctly. Guys, all listeners, what is that one thing which can help you shift your from sympathetic to parasympathetic? And by the way, you do it every day, but you don't do it correctly. That's a big hint
Okay.
I've given you.
Okay.
Guys, in the comment section, please. I'll count till 3. 1, 2, 3. No, Ramya, I'm saying breathing is not working these days. Gargling, यार, ब्रश करके गागल्स करते हो, जोर जोर से करो. Guys, we are forgetting the basics. Your all autoimmune patients should know that after brushing their teeth, they will do gargling for 30 seconds or 1 minute. Do you think that's difficult? Those
See,
30
oil pulling is also very good for
oil pulling will not shift you from sympathetic to parasympathetic. Oil pulling is good for
detox.
Yes, for infections,
for
for
detox.
Yes, but I'm talking about parasympathetic activation. So if you brush your teeth, if you brush your teeth, gargling to साथ में आना
which we all do.
Which we all do, but we don't do gargling properly, Dr. Millie. Tomorrow morning, see how you do gargling. Two. We don't do it properly कि भाई हमारा parasympathetic activate हो जाए. So that is very, very important. And breathing, I to have crossed breathing. I don't train my patients on breathing for the first 6 weeks. Because मैं कितना भी कर लूं, नहीं होता है उनका breathing ठीक. Half I'll train them. Next time they will come again, they are breathing in the sympathetic mode. So sometimes not very small things, but when you are doing them daily, तो बहुत फर्क पड़ता है. Second, one more thing which I want to iterate on in psoriasis cases is there is a lot of heavy metal and toxins in these patients.
Yes. So I was coming to the third case.
Okay. Yes. Over to you.
Okay. No, so the third case which I want to put forward uh, was always a patient with so much of hypertension, so much of, in the sense, the patient is in agitation, in tachycardia mode, in always, anxious, anxious, anxious. So this patient, I said, I want to do chelation. Okay. If
Very effective.
chelation, very good for heavy metal toxicity detox, and the chelation, once we, I mean, of course, patient starts feeling better. This chelation is not for the hard chelation, which is like alternate days or something. I just did one chelation drip for, so 3 times a week patient came, twice ozone, one time chelation. And that was the pattern. And of course, one of the days, so how was it? Rectal minor, minor major, and chelation. Another time rectal minor, minor major, and nutrition drip. Like that, it kept going in
Oh,
circles.
even if
And
you
the
do
chelation,
chelations, the response is very different.
yes, yes. But you have to find their history. Okay. So, or you get them tested like oligoscan, you can do it. Or you can
Only
get them do thyrocare ka metal toxicity. You can get it tested, get them understand that this is metal toxicity is there. You have to chelate, you have to detox. And, the patients give very good. Okay, one very interesting omega vein, you know, after chelation. I mean, I've seen very good results with it for skin patient. Huh?
so omega
So,
when immediately after chelation or next day.
no, I do it after chelation. So I've
Right.
removed and I have given chelation. I have given, omega vein.
Omega.
Of course, everybody has a different way, but I have treated my patients. But I have only 3 times a week. They can come.
No, no,
Okay,
even
so
two
in
times a week works. See, we understand patients can't come for multiple times because every visit also is about 2 hours.
yeah.
Chelation, when you do, it's 2.5 hours, right? But twice a week also, I've seen if people can come for about 6 weeks to 8 weeks.
So
Then,
here I can add here, Dr. Preeti, if your patient, you can do keystone. So you do ozone, major auto, and piggyback, you can give only chelation. Like, so the ozone has improved your microcirculation, and then you give EDTA. It will leach out all the metals sitting in any tissue of your body, and it will be out faster. So but of course, all chelation drips, we don't give vitamin C.
all
Yeah.
chelation
So,
drips, I do saline ozone before my chelation.
okay.
My chelation means ozone, saline ozone, and then chelation.
We do major auto, but yes, you can give 150 ml of ozone saline and then do it.
हाँ I give good 200 अच्छे से ओजोनेट करके मेजर ऑटो आई हैव नॉट ट्राइड आई विल ट्राई इट नेक्स्ट टाइम
You can. It works very well.
दैट्स गुड
Works well.
नाइस perfect any other questions people have there is a question Dr. Millie because we've already been here for 50 minutes though this was 30 minutes but there's this question we should take before we say bye bye otherwise we can keep talking it's so interesting what are some of the contraindications of major autohemotherapy for Hashimoto's and Graves what would be the ozone guide
So the Graves disease we don't treat with ozone. Hashimoto's, yes, we do treat with ozone. Uh, b- Asking for contraindication for major auto only,
yes
G6PD deficiency is the first thing. Hyperthyroidism, we don't give ozone because ozone enhances your metabolism. In hyperthyroidism, you're already highly, having too much of high metabolic rate. Thrombocytopenia, so if your platelet count is less than 50,000, we don't give ozone. Coming to if we are so hyperthyroid, thrombocytopenia, the severe convulsive state. So if patient is epileptic, then we have to be very careful. These are all precautionary measures. But before doing any IV ozone, check for G6PD. It is mandatory.
I
Mandatory. Okay.
G6PD value should be written on your ozone consent form.
Yeah.
I'm sure
Yeah. My
everybody.
data sheet has topmost is G6PD if I'm doing IV.
So I, on my consent form, which all my patients who do ozone therapy with me sign, I have this G6PD mentioned there.
That's good. That's good.
Yes. Perfect. So is ozone used as primary therapy or as an adjunct? As an adjunct, of course, you have to make sure that the diet is good, the environment in the body is good, the stress is
Okay.
handled well.
No, so here I want to add any acute case you can use it as a primary. Say I would if I have any malaise like fever like syndrome, I take ozone, I become all right without taking medication. Okay. So what are
Hmm.
you looking at primary and secondary? I mean, I am looking at patient
This is
uh,
for psoriasis,
with
Dr. Millie. He's asking for psoriasis. Is this a
oh okay.
primary
It
or
is a
on
supportive therapy.
it?
I would
Yes.
say supportive,
Yes.
but
Yeah.
it is integrative. It is
Yes.
integrative.
And very, very effective. If out of the 3,600 doctors who've been trained in ozone, anybody here is listening and is not using ozone for psoriasis patients, my humble request, haath jodkar, start using it. Your patient will come and thank you.
Yes, agreed.
Thank you, Dr. Millie, for being here. I learned few things today again, so I'm going to help more patients tomorrow. And it was a lot of fun to talk to you.
I promise I will gargle well tomorrow. Thank you.
Thank you.
I learned
Thank
that.
you very much. Thank you. Thank you.
Thank you.
Yeah.
Bye
Okay,
bye.
Ji. Bye bye. Take
Thank
care.
you.
Thank you, everybody, for joining.